If you are in Ghana and you are planning to fall sick, Charlie, let me tell you, this is the wrong time. This is absolutely the wrong time to fall sick, because if you fall sick and you go to the hospital, you are not going to get any care, because those who are supposed to take care of you are on strike. You are not going to find them in the hospitals. I'm talking about the nurses and the midwives. Ghana Registered Nurses and Midwives Association are on strike over some demands that they brought before the government and have not been implemented yet. So guys, let's have a conversation about this health crisis that is happening in the country right now, what you should know about it, and you can also tell me what you make of this strike in the comments below. This is the News God. My name is Angela Delademkufo. You can call me Miss Angie Shima. Let's get this story rolling. Now, this GRNMA strike issue, should I say, began last week, Wednesday, and is persisting till now. So it's almost a week. It is 1 week now. Why are they striking? Now, somewhere last year in August, the nurses, the association, brought some demands to the government, that is the previous administration. They listed a number of things that they wanted according to their conditions of their service. So I think the government promised to capture them in their next budget. Fast forward to 2025 and a new administration took over, the Mahama-led administration. Now, if a new government takes over, we obviously know that they are going to look at previous agreements, previous documents, and this one would also be seen, right? But when the first budget was read, it wasn't captured. It wasn't captured. Nothing was said to these nurses and midwives. If it was indoor, we don't know, but outdoor, nothing was said to them. That is why they are striking. Now let's look at some of their demands first. They have listed a number of things, but let me give you some of the things that they are asking for. One is book and research allowance. They also ask for uniform allowance, fuel allowance, 13th month allowance, night or out of station allowance, vehicle maintenance allowance, kilometric allowance, funeral grant, annual professional license renewal fees. That is just some of the things that they are demanding for. But if you look at this list, the funeral grant, and that one, some of them make sense, but the funeral grant, nurses, like the government should pay you when you lose someone, or I don't get it. But others look substantial, but this funeral grant, dear. But anyway, they are the one in the field. It is their job. I don't know what they are going through, but this is what they are demanding. And we all know that the first budget didn't capture them. So that is why they are striking. That is why they are striking. I think the government promised to look at their demands coming 2026. But they don't want that. They say 2026 is too far for them. They have been suffering, enduring this under poor conditions. They call it poor conditions for a long time. So they want the government to, as soon as possible, implement what the previous government agreed upon. The previous administration said they could do it. They agreed that they could do it. They saw something. They stood on something. And so why is this present administration not seeing what the previous administration saw to implement it? That is what. So if you go to hospitals, I had the privilege to go to some hospitals yesterday. I went to Achimota Hospital, for instance, and the place where, like the hospital, the OPD, it was empty. It was empty. No one was there. You couldn't see nurses. You couldn't see doctors. You will see doctors, but doctors are not supposed to do nurses' work. You get what I'm trying to say? Nurses' work differ from the doctors' work, and some doctors have to double work now, doing their performing their own responsibilities, and they're performing the responsibilities of the nurses now, and they can't do it because they are not professionals in caregiving. They are professionals in medicine, administering medicine, and not caregiving. This is the nurse's job. But notwithstanding, some nurses also were present at the hospital. I'm talking about the Achimota Hospital, for instance. Some nurses were present, but not in uniform. They were in mufti. So they didn't come there in the name of I'm a nurse or in the association's name. They came there as, I would say, empathy, out of empathy for the people in there. Patients who are trooping into the hospital and being turned away and not given enough care. So they came there out of empathy. And some of them could be penalized, you know, if the head, the association is saying don't go to work, and then you stubbornly, oh, I want to take care of people, so I want to go. They could be penalized because this is your association, right? But this is what is going on in hospitals. Some people are being turned away. The OPDs are empty. Doctors are suffering. A lot of people are complaining. Now that brings me to the question too. Nurses have an oath. Nurses have an oath to take care of people. Can we say that they are neglecting that oath as well? Can we say that? Although your conditions need to be met, you need to be in a comfortable position to work. Remember that you swore an oath to take care of people. Remember that. That notwithstanding, Ghana Mortuary Workers Association, their secretary, in an interview he had on GBC, I listened to that interview, and he has been complaining of the death toll that is rising. The mortuary workers are lamenting because the number of dead people that are being brought into their facilities is becoming alarming since last week. That means that people have been left in the hospital without any care and they are dying. They are dying. And he complained that if this continues, eventually the mortuaries are also going to be full. And you wouldn't like it. You wouldn't like to come to the mortuary and see your father being packed on another person. But that was his complaint. So the government should actually listen to the pleas of these people, give them some substantial answer or something to hold on for if you can't implement all their conditions, but at least something. He also mentioned that if the Ministry of Health or the association are not having an agreement, they could talk to someone higher. You know, even with us individuals, if you are having an argument with someone and then you are not seeing eye to eye, you could bring someone in, someone that you both respect, and then it will be solved amicably. He mentioned that as well. If the Ministry of Health and the Nurses Association are not seeing eye to eye, then someone with a credible character should come in and intervene. Someone like the president. People listen to the president because of his charisma and then his credibility. So if the president comes in, talk to these nurses. Oh, dear nurses, we know this is the condition, this and this and that, but we promise this. Please come back to the hospitals and we will do this for you. It will be nice, but President so far hasn't said anything. It is just the Ministry of Health talking to this Nurses and Midwives Association, and there's no understanding so far. But let me bring you to what the Ministry of Health is suggesting so far that the strike is ongoing. He first, in a press statement, said, asked retired nurses to come and fill in the spaces. Retired nurses. We are talking about old people, people who have been out of service for a long time. I don't know how their service is, but you know, when you stop doing something for a long time, you may probably forget about it. An old nurse who has stopped practicing for about 5 to 10 years, you ask the person to come and give a medication or injection. Haven't they probably forgotten maybe this vein is the one that is supposed to receive this injection, and this is when you are supposed to do this and that? And these are old people, because in Ghana, people, we retire at 60. These are old people. Some of them have sight problem. Some of them have menopause and andropause. They are dealing with a lot. And you call these old people to come and take care of sick people. This isn't a good thing. You know, this isn't a good thing at all. And these nurses that are striking are their children. their children. So you are not taking care of our children and you are telling us to come and take over from them. Will you pay us? Will you compensate us for our service? Nobody knows about that. The minister also, on his social media yesterday, he posted some statements. So I'm going to read that briefly to you. In one of the statements, he says, upon assuming office, I have on behalf of government engaged several times with the GRNMA to explore the best possible avenue to approve and implement the new conditions of service. He also says that while working round the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. Some of those what are you talking about? Some of those include the bringing the retired nurses to take over. He also says that government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. He concludes, government reiterates its commitment to dialogue with the GRNMA with a view to resolving this impasse for full nursing services to be restored. These are just statements. These are just statements and not solutions, Mr. Minister. With all due respect, I didn't find anything solid here for the nurses to hold on to and come back to work. These are just promises, something that they've been hearing for over a decade now. Mr. Minister, please sit up. So upon reading this, I was forced to go into the comment section of this post, and what I saw was so wild. People came after him a lot. You know, some people said that this same minister, Honorable Akando, when he was in opposition, was lamenting on the previous health minister's performance. He was even calling for his resignation, and then you come into power and then we see strike. What are you trying to tell us? Because in the previous administration that you were calling for resignation of the health minister, there wasn't any strike. They were able to contain these nurses. But you, it's your turn and you can't do anything. People really bash the health minister a lot. And I should say, from this statement, like I said earlier, there's a lot to be done. They need to sit down and, like the Mortuary Workers Association workers suggested, bring someone in, someone that the nurses could trust, have conversations with them, let them understand what is going on, and when we are going to capture them and implement their conditions of service. So, as I began, if this is the time that you want to fall sick, please, it is a wrong time, because care will not be given to you. You may end up losing your life, or your condition will worsen for life. Let us do better as a country, as a whole, because this is lives we are talking about. We can't keep playing with the very foundation of our country, which is the people. There is no country, there is no governance without its people, and you can't govern a country or a group of people who are weak and sick. Doctors, nurses, midwives all need to be catered for. They are very essential. Their services are very important to us. Let us know what you also make of this strike in the comments below. If you have any concerns, if you have any advice as to how this should be done, please share that also with us. And don't forget to like, share and subscribe to the News God for more. My name is Angela Deladem Kufuor.